Hi, I'm JayCee, and today I will be sharing my practicum experience for island sexual health. I wanted to first acknowledge that I live, work, and study on the unceded Coast Salish territories of the Lekwungen peoples, Songhees, and Esquimalt nations, as well as the Wet'suwet'en nations. I am very grateful for their stewardship and strive to contribute to reconciliation throughout my public health work. Island Sexual Health is a nonprofit our organization, sorry, and providing inclusive sexual health education as well as clinical services. They also provide gender affirming care, and they've been in operation since 1969. They serve over 40,000 people annually. ISH was my first choice placement because of my passion for sexual health education. And since, of course, the program did not offer this as a dedicated focus, I pursued disability studies due to its overlap with sexual health accessibility. And this practicum allowed me to develop my skills and create educational materials that promote sexual health care accessibility. So during my practicum, I contributed by volunteering in the clinic, supporting some event coordination and developing accessible community resources like a period product map, which I'll talk about momentarily. These experiences strengthened my skills in public health communication, program planning, and cultural safety. And the image here that I just had to really quickly squeak in is Devin Black, co-chair of Access BC, who not only, my text decided to cut off. So they attended our ISH fundraiser, and they have the award for greatest sweater I've ever seen in my life. And they also played a huge role in making prescription birth control in BC free, which is a huge win for sexual health access. So in the clinic, I was able to assist with organizing and labeling patient samples for life labs, cleaning and restocking the clinical care rooms, and assembling self-harm reduction and safe sex kits, including condoms, lube, and safe injection supplies. The image here is just of the small pantry at the clinic that holds these supplies, as well as some non-perishable food items for community members. And this experience really reinforced the importance of accessible as well as inclusive healthcare and deepened my understanding of the very diverse needs of people in our community. So one of my most engaging projects that I was able to work on was the Interperez photo exhibit, which explored reproductive justice in Bangladesh, El Salvador, and the Philippines. I was able to collaborate with some of the social work practicum students, and I got the opportunity to lead a high school tour, facilitate discussions on sexual health, and engage with other community members at the fundraiser, as well as UVic's Fem Expo. So the ISH fundraiser launched my practicum passion project, which is a campaign called What I Wish I Learned, that invited youth to share what they wish they learned in sexual education. So the project was able to highlight some gaps in traditional sex ed, like LGBTQ plus healthcare, pleasure, consent, and it also encourages public discussion on improving curricula. So if you have a moment, and we would love for you to participate in our survey, it's just 2 quick questions. You can scan the QR code, or I will actually just drop the link in the chat once I'm done speaking. So beyond the clinic and event work, I also contributed to expanding ISH's educational resources by adding virtual book resources and podcasts. And then I also designed a period product community asset map, which identifies about 35 so far spaces in the Greater Victoria area where people can access these free menstrual health products. This map will soon be available on the ISH website, but I will also drop the link in the chat for that one as well. So the 2 values that strongly guided my work here were community-based approach, which is what I used while collaborating with the local organizations to create my accessible sexual health education resources, and diversity and cultural safety, which I applied across all my projects to ensure the educational materials that I put together were inclusive of the diverse identities and experiences. Sorry. And throughout my practicum, I was able to apply the key knowledge areas, including health communication, making sure to use plain language in sexual health materials, program planning by expanding ISH's virtual resources, and community engagement, facilitating in public discussions on sexual health at the photo exhibit. So the Truth and Reconciliations Call to Action 22 is the one that I chose because it emphasizes integrating Indigenous healing with Western medicine. So during my practicum, I was able to consult with the Indigenous team member, McKenna, to ensure that my materials that I was putting together were able to reflect some Indigenous teachings on sexuality as well as reproductive health. My most valuable experience, I think, was volunteering in the clinic because it really reinforced why sexual health is critical to public health. And my key takeaways included how accessibility is essential in public health education, how community-driven initiatives make such a huge impact, and how intersectional approaches are crucial in sexual health education. And moving forward, I aim to develop skills in health policy analysis and advocacy to support inclusive public health care initiatives. The biggest challenge was definitely balancing multiple responsibilities. Clinic work, event coordination, research, as well as my own work definitely was a bit stressful for those couple of months. But my biggest surprise was just the absolutely overwhelming support from the ISH staff and volunteers that I was given. It was so refreshing to volunteer in such a just a genuinely helpful space where everybody really wanted to see me succeed. My major highlight was seeing the impact of the What I Wish I Learned campaign, reading all the students as they shared their experiences, emphasizing what they wanted to learn in sex ed and hopefully will improve our curricula in the future. And the biggest achievement was definitely launching the period products map because it'll be available for a long time, and it really reinforced my commitment to equity in health. My biggest advice for any future students is that you need to be adaptable because there are so many opportunities out there and you never know when they're going to show up. But take initiative. If there's something you really want to work on, just ask, and I promise they want you to be able to do what you want to do in this practicum. But also plan ahead because I know that I took on more responsibilities than I probably should have. And the time just moves by so fast. I wanted to thank Margaret, of course, my practicum supervisor, Jen, who is incredible, Kim, the volunteer coordinator, and McKenna, whose insights helped me incorporate the Indigenous perspectives. I also wanted to thank my fellow practicum students, Emily and Naya of social work, and of course, Talia in public health, for making this experience absolutely the most rewarding I could have had, as well as my partner for their support throughout this journey. And I look forward to contributing to this work in public health in the future. And here are my references, but thank you for listening to my presentation.